Hey everyone and welcome. Well, in this video we've got vindication. Now, I found an article in the Mail regarding a study that proves what we have all been shouting since this shite show started, and that is lockdown did nothing to stop the lurgy. And across Europe, the study finds social distancing did.
And I do believe that we have rotten politics, and I'm not using that as an exaggeration. Rotten politics in this country at the moment.
So effectively our economy has been trashed for absolutely no reason other than lily-livered fear and the media's constant bitching and fear-mongering. It's titled, "Was Britain's lockdown a waste of time? Scientists find draconian stay-at-home orders had little effect on curbing lurgy outbreaks in Europe, but closing schools and banning mass gatherings did." See what I mean, everyone? Vindication. Isn't this exactly what we've been saying from the start? I think it is. Let's read and shout "No shit Sherlock" at the screen, shall we? East Anglia analysed policies in 30 European countries and found only some measures effective. They wanted to see which were the best at controlling the pandemic as countries worldwide locked down. Banning mass gatherings and closing schools were the most effective ways of stopping virus spread, but stay-at-home orders and shutting non-essential businesses had little effect, the scientists claim. It comes as Boris Johnson is expected to agree tentative moves to lift outdoor restrictions this week. Draconian stay-at-home orders and shutting all non-essential businesses had little effect on fighting the lurgy in Europe, according to a study. But the same scientists discovered closing schools and banning all mass gatherings did work in slowing outbreaks across the continent. University of East Anglia researchers now say relaxing the stay-at-home policy and letting some businesses reopen could be the first step to easing lockdown. The findings throw into question whether Britain's total lockdown, announced on March the 23rd, was ever necessary amid claims social distancing policies are announced on March the 16th curbed the crisis on their own. So what they're saying is that the lurgy lockdown is pretty much pointless. Other leading scientists have claimed Britain's lurgy outbreak peaked and started to decline before the official lockdown began, arguing that Number 10's drastic policy to shut the UK down was wrong. UK's Number 10's policy originally was herd immunity, just like Sweden did. It was the media and other MPs that forced the lockdown, and the Twatterati who forced the lockdown. Transport use plummeted and fewer people were visiting GPs with telltale lurgy symptoms the week before lockdown, suggesting the government's call for the public to work from home where possible and to only take essential travel was effective enough. And one Swedish researcher, Dr. Johan Giesecke, who has seen his country resist calls for a lockdown but escape relatively unharmed, said the pandemic is unstoppable and everyone will be exposed to the lurgy sooner or later. Now, this is exactly what I've been saying for quite some time, isn't it? That the lockdown has done nothing other than lock us in close proximity with people that might be infected. There is actually a study in America at the minute, and it is finding that just in New York alone, 60% of everyone that was infected in the home. Not on the bus, not at businesses, not at work, not on the street, but at home. It comes after Boris Johnson yesterday confirmed that strict rules imposed under the 6-week lurgy lockdown will start to be eased on Monday, on the same day that Britain's death toll became the first in Europe to rise above 30,000, and the number of people diagnosed with the disease surged past 200,000. Every single country in Europe is taking the numbers differently, so when they try and say that we're worse or better than any other nation, it's rubbish. There is no way of knowing that until we get all of the figures in after it's happened. This is just hearsay to scaremonger everyone into staying indoors. The Prime Minister will outline a 5-step plan for Britain's second phase on Sunday, with the government set to drop its stay-at-home message and replace it with "stay safe." Should have been "stay safe" at the beginning. But as the UK and other countries in Europe prepare to lift restrictions, the World Health Organization has warned them not to be afraid of restarting them if the virus begins to take off again. Right, at this point, I would like to stress Sweden, as it said earlier on in the article already, Sweden didn't lock down and they haven't had a dramatic increase in cases. So therefore, you can shut up, World Health Organization, talking about restarting a lockdown again. It's being proven that that doesn't work. But then It's nothing unusual, the World Health Organization giving out facts that are not facts and that are absolute fabrications, is it? Writing in an article in The Lancet, Dr. Gisek said many countries and members of their press media have marvelled at Sweden's relaxed strategy in the face of the lurgy disease pandemic. Schools and most workplaces have remained open and police officers were not checking one's errands in the street. Are you listening, Met Police? UEA researchers looked at a range of social distancing measures adopted across 30 European countries. They cautioned that the study, which was funded by the National Institute for Health Research Health Protection Research Unit in Emergency Preparedness and Response at King's College London and Public Health England, is experimental. Banning mass gatherings along with closing schools and some non-essential businesses, particularly in the hospitality sector, were the most effective ways at stopping the spread of the disease, the researchers found. They said that more investigation is needed on the use of face coverings in public, as the current results, which do not support using them in public, were too preliminary. So that last paragraph there, they said more investigations is needed because they've found that face coverings don't work. So it must just be preliminary because they've found that they don't work. I think that's probably because somebody's got their hands in a PPE company, maybe. One of the scientists involved in the research, Dr. Julie Brenard, said they had found clear distinctions between which measures were more effective. We found 3 of the control measures were especially effective and the other 2 were not. So it will be social distancing, banning mass gatherings and closing schools. It pains me to say this because I have kids that I'd like to get back into education, but closing schools was the most effective single measure, followed by mass gatherings. This was followed by what were defined as the initial business closures. So that was the point when, in the UK for instance, they closed gyms and clubs. Now can I just say as well here, they say closing schools was the most effective, but aren't they unsure whether children can pass it on to adults? I've heard numerous scientists say that there's no proof that children are passing it on to adults. So why can they now say that closing schools was the most effective single measure? That doesn't make sense, does it? Adding very little additional effect was the stay-at-home measures, surprisingly, and the additional business closures. The research adds to claims from Dr. Johan Gisek of Stockholm's Karolinska Institute that total lockdowns are unnecessary because the virus is unstoppable. You hear that, everyone? This is exactly what Boris was saying at the beginning and what we've been saying, well, a lot of us have been saying from the beginning. Herd immunity is the only way forward. Do you want to know why? Because vaccines aren't cures. Vaccines just give you a small dose of what they're trying to stop you from getting, with the purpose of boosting your immune system. Now, I don't know if you've thought about this, but that would then mean that we would need to take that vaccine every single year. Massive money grabbing and money making enterprise, that, is it not? This is coming from the same people that say they need it to be passed out throughout the world to everybody. Imagine the money they're going to make off that, the pharma companies. Just saying. Although he admits the benefit of preventing hospitals from becoming overwhelmed, which the UK government says has been its aim all along, it has become clear that a hard lockdown does not protect old and frail people living in care homes, a population the lockdown was designed to protect. You want to know why? You know what I find a problem with? They stop people that have got other illnesses going to hospital. I actually suspect we've probably killed a lot more doing that than the lurgy itself. Now we are all aware that they are putting the lurgy down as cause of death even when it wasn't, and even when it's dubious. They're not doing autopsies to prove it was lurgy related. They're just saying, oh well, they had lurgy, so therefore they died with lurgy. Neither does it decrease mortality from lurgy, which is evident when comparing the UK's experience with that of other European countries. Now at this point, I'd like to say Germany have relaxed their lockdown slightly, and their numbers are not going up. That should tell you everything, shouldn't it, about the actual lockdown. Dr. Gisek explained that estimates in Sweden suggest a quarter of 2.4 million people in the capital, Stockholm County, have had the virus already, and around 99% of them were never diagnosed. the country has recorded only 2,941 deaths, only a tenth as many as Britain. Now, you will find people that will say that's because the population isn't as high, and that is true. But what they won't tell you as well is that Sweden has 3 main cities, and a lot of the population live in those 3 main cities. So they are very, very densely packed in these cities. Stockholm being a prime example, Malmö being another. And yet, no lockdown, and they've had less than 3,000 deaths. And this same scientist did actually say the one place that Sweden failed was they didn't lock down the care homes quick enough. And Sweden's care homes are massive, whereas the countries around them all have local care homes, so they're a lot smaller. So their numbers would be a lot less, would they not? I'm just putting that out there. He added, these facts have led me to the following conclusions. Everyone will be exposed to severe acute respiratory syndrome, lurgy, and most people will become infected. Lurgy is spreading like wildfire in all countries, but we do not see it. It always spreads from younger people with no or weak symptoms to other people who will also have mild symptoms. This is the real pandemic, but it goes on beneath the surface, and it is probably at its peak now in many European countries. There is very little we can do to prevent this spread. A lockdown might delay severe cases for a while, but once restrictions are eased, cases will reappear. I expect that when we count the number of deaths from lurgy in each country in 1 year from now, the figures will be similar regardless of measures taken. And that's what we've been saying from the beginning, isn't it, everyone? We've always been saying that we can't see how this lockdown could actually possibly do anything to benefit us. In fact, most of us have been screaming from the rooftops that it's going to cause more harm than good, i.e. cripple the economy, and we'll be struggling for money for a long time. So would our children, probably. The University of East Anglia researchers looked at the number of cases and deaths taken from the daily published figures by the European Centre for Disease Control. These were compared with the start dates of different measures, including the restriction of mass gatherings, the closure of schools and different types of businesses, stay-at-home orders and the wearing of face masks. Lead researcher Professor Hunter from UEA's Norwich Medical School said the study shows that school closures in Europe had the greatest association with the subsequent reduction in the spread of the disease, but it does not clarify the ongoing puzzle of whether children can pass lurgy to adults. See, that's what I said earlier on, isn't it? There is no evidence and no proof that children can pass this on, and yet we've closed the schools. Does it not seem to be mostly knee-jerk overreaction at this point with this article? It sounds like everything has been an overzealous knee-jerk reaction. It's basically fear. He said, and it does not identify which level of school closure has the most impact, whether it is primary, junior, senior school or even higher education. It's also important to remember that our results are based on total closure, so it is possible that partial school closures could have worthwhile impacts on the spread of infection. Banning public and private mass gatherings was another key tool in fighting the spread of the virus. Professor Hunter noted that the size of the current banned mass gatherings varied between countries, and so the importance and impact of the scale of the individual event is still not clear. Dr. Brainard of UEA's Norwich Medical School said the researchers were really surprised to learn that stay-at-home orders may not be needed to control the outbreak, provided that this did not lead to more mass gatherings. It was found that these stay-at-home policies were not linked with a decline in incidences, and that as the number of lockdown days increased, so did the number of cases. So there you go. Proof that the lockdown has done nothing other than continue the cases. So it's not benefited us in any way, shape or form other than lose millions their jobs and lose millions their income and lose millions probably companies. Differences in how the countries carried out these policies have ranged from them being an advisory notice in some places where elsewhere they were orders which were enforced by police with penalties. The shutdown of non-essential businesses, which included places where the people gathered such as pubs, leisure centres, restaurants and venues, also had an impact on the spread of infection in each country. Professor Hunter said, this suggests that keeping some businesses closed, particularly in the hospitality and leisure sector, would have the most impact. However, we also know that while outbreaks of food poisoning are frequently linked with restaurants, outbreaks of other respiratory infections, generally in the hospitality sector, are fairly rare. Now, I highlighted that because if it's fairly rare, why are we closing them down? You understand what I mean by that? So that's effectively stating that there's no evidence that any of this lockdown is working, really. I mean, if it's fairly rare to get respiratory infections in restaurants and hospitality sector and the leisure sector, why did we stop it? Who said we can stop it? Dr. Joshua Moon of the University of Sussex Business School noted that differences in testing rates and strategies in each country would have an impact on the number of cases. Yep, because every country in Europe at the minute and the world are taking the numbers differently. So some will just count hospital cases, some are counting hospital and care home, some are counting hospital and home. It's all over the place. So that's what I was saying before. You can't correlate one country's results to the next. That's why the gentleman earlier on said that after a year, then we can look at the figures, and he said that we would probably find not one of these responses worked. Not one. He said the study may indicate that stay-at-home orders could be the first things to be relaxed. Mr. Moon said, "We have to remember that decisions like this cannot and should not be made on a single finding, nor should policy be made based solely upon science. There are many social, economic, political and moral factors to consider that science simply cannot answer." So he's saying decisions like this can't be made on a single finding, and yet the decision to lock down was made on a single finding. When it comes to this pandemic, caution is paramount. Otherwise, we could tip too far and risk a second wave and return to lockdown. Can I just say, Sweden haven't had a second wave, and they aren't locked down. The caution sentiment is in line with warnings from the World Health Organization. Oh, well, that's a fine then, isn't it? Let's do everything that these muppets say then, shall we? Its Director General, Tedros, communist sympathizers, said countries must act slowly and be willing to roll back if the virus spiraled out of control again. Not a chance. He said in briefings yesterday, the risk of returning to lockdown remains very real if countries do not manage to transition extremely carefully and in a phased approach. Shut up, WHO. Nobody cares what you think anymore. Apart from Boris, obviously, who keeps pumping you full of money. The lurgy pandemic will eventually recede, but there can be no going back to business as usual. Why? Is it because your whole world order is not going the way that you want anymore, so you want to keep us locked in until our economies crash, and then we'll be crying for you to help us? Is that what your long-term plan is? Because that's what it's looking like. Senior Emergency Officer at WHO, Dr. Catherine Smallwood, said that moving out of lockdown must be done in a step-by-step manner, that it is gradual and is cautious, the Mirror reported. Right, can I just say at this point, if scientists are saying that the lockdown isn't working, why have we got the WHO saying that we need to come out of it slowly? You see what I mean by this? The WHO are not a health organisation at all, in my opinion. They are a propaganda machine. This is just more propaganda to keep us scared, to keep us in our house, and to keep us obedient. Think I'm wrong? Let me know. Researchers from the University of Newcastle, the London School of Hygiene and Tropical Medicine, University of Technology in South Africa are also part of the study team. Experts not involved with the research said the difficulty lies in separating the effects of individual restrictions when in many cases they were introduced at the same time. Dr. Baynard addressed this in a Radio 4 interview, saying, because none of the countries implemented all of the measures and there was variable timings, we can kind of look at separate timing. Professor Keith Neal, an epidemiologist at the University of Nottingham, said the main limitation of the study is that in many countries various measures were put in place at the same time, making it difficult to disentangle which effects were having an impact. The strength lies in looking at data from 30 countries. The more of the lockdown restrictions that have a minimal, if any, benefit in controlling spread that are then relaxed, the better the physical and mental health of the country will be. Can I just say, any lockdown is not going to help our physical and mental health. I mean, these scientists are effectively saying the lockdown isn't working. Why are we even talking about removing it slowly? Why not just come out right now? Just say, right, scientists have said it's fine. Get yourself out there. They found stay-at-home orders and closure of non-essential businesses appear to have minimal effects on transmission prevention. Relaxing these would therefore likely to have minimal adverse consequences on the pandemic. epidemic. In controlling spread, their main finding was that school closures were important. As many schools have now gone, or soon will go, back in Europe, the impact of school closures and the reopening will become apparent and help the UK's exit strategy with real data. Next of importance was the banning of mass gatherings comes as no great surprise and also has little impact on the economy overall if it needs to be continued. Right, here's the first opportunity, guys, for the line. No shit, Sherlock. Did you say it? Did you? The paper helps those planning the exit strategy with some more science. Despite Number 10 confirming that lockdown will start to be eased on Monday, it is expected the measures will be extended for another 3 weeks today. They better not be. On Sunday, Mr Johnson will unveil a series of easements to the nation, which will be announced after the Cabinet finalises details. The government's stay-at-home message will be replaced with a "be careful when you're out" mantra, according to one Cabinet minister. We were always careful when we were out, muppets. The minister added that easing the lockdown will be based on how much each step of the plan affects the rate of infection. The government is thought to have drawn up a draft of 50-page blueprint to gradually ease lockdown in staggering steps between now and, you ready? October. Yes, you heard that right. Ease lockdown in staggered stages between now and October. So they're not lifting lockdown until October. You see what I mean? Just removing a certain amount of the restrictions doesn't mean that we're not still locked down, does it? This blueprint is expected to lead to a 5-step roadmap to see Britain leave lockdown completely by autumn. But an emergency brake could be applied if a second wave of the deadly virus arrives. And who've we got to tell us about the numbers, have we? Who is it that tells us the numbers on this? Is it the same scientists that have been wrong all along so far? Because I think it probably is, isn't it? The leading Oxford University expert has urged that the peak of Britain's lurgy crisis was a week before lockdown was announced, and that the early warnings for people to try and social distance and to wash their hands regularly had an impact all on their own. Professor Hannigan claims data clearly showed infection rates halved after the government launched a public information campaign on March the 16th. Health bosses urged Brits to wash their hands and keep up 2 metres apart before rolling out the unprecedented lockdown that was forced by the media and the left-wing Twitterati. Professor Hennigan argued ministers lost sight of the evidence and rushed into a nationwide quarantine 6 days later. Yep, they shite themselves and cried to the WHO, and the WHO said, lock your country down, and EU said, yep, you better lock your country down, and our government bent over and took it like a good little slave. He said that they were instructed by scientific advisors who had been consistently wrong during the crisis. Professor Hennigan hailed Sweden, which is what I've been saying all along, is it not? Which has not enforced a lockdown despite fierce criticism for holding its nerve and avoiding a doomsday scenario. So this professor thinks if they'd have locked down, they would be in the same scenario as us, and he classes this as doomsday. He told Mail Online the peak of deaths occurred on April the 8th, and if you understand that, then you work backwards to find the peak of infections. He referred to a delay in the time it takes for an infected person to fall seriously ill and die, 3 weeks on average. Data shows the rate of Britons with upper respiratory tract infections dropped from 20 per 100,000 people on March the 15th to around 12 per 100,000 just 6 days later. Now, I know it is getting a bit long, this video, everyone, but I want to get to the end because I think this is important information that we all need to know, because it illuminates a few things, does it not, in regards to this lockdown and how ridiculous it all is? The figures do not relate solely to the lurgy, but may be a good indicator because so few people were being tested for the deadly infection. Explaining the logic behind his claim, Professor Hennigan said, the UK government keeps saying it is using the best science, but it appears to be losing sight of what's actually going on. We've been getting scientific advice that is consistently wrong. It has failed to look, and that's the WHO passing on bad information to our scientists, who are then unable to come up with a good study on it because they're given the wrong baseline facts. Is that not what is happening here? He added 50% reductions in infections occurred on March the 16th, right when hand washing and social distancing was requested. Some scientists have suggested that splitting the lockdown into 2 tiers based on a personal risk could be a more effective way of managing them. Now that sounds to me, 2 tiers based on personal risk sounds like clean, unclean, healthy, unhealthy, safe, dodgy. You understand what I mean by that? 2 tiers basically says we are going to create a subclass of people in our country. But do you think I'm wrong on that? That's what that sounds like to me. Researchers at the University of Edinburgh suggested that people vulnerable to the disease, such as the elderly and those with serious health problems, or those that have not taken the vaccine or taken on the app, I reckon that would come, should abide by stricter rules than young, healthy people who are less likely to die if they catch the lurgy. And so I was right then. So it's going to be healthy, unhealthy, restricted, non-restricted. You understand what I mean by that? They said the approach, dubbed segmentation. That's a new way of saying segregation, is it not? Segmentation. Oh, they fluffied the word. You know why? Because if they'd have said segregation, people wouldn't accept it, would they? And shielding. It's not shielding. It's actually ignore the oldies, to be honest. If you want to know why they like that, it's the same reason they always take the pensions away when we're running out of money. It's because the old don't make tax, so they don't care. It's the only way to get the UK back to normal without overwhelming the NHS and causing a second wave. Overwhelming the NHS? I know people that work in the NHS and they're all no work whatsoever. Loads of time on their hands. They can do choreographed TikTok dances left, right and centre while using PPE. And the same again in regards to the second wave. There's no evidence that there even will be a second wave. Healthy Britons should be allowed back out, but stringent contact tracing, social distancing and hand washing rules will need to be in place. Anyone with symptoms, are we ready? Anyone with symptoms would need to quarantine along with their entire household for 2 weeks. And yet, earlier on they said there is no reason to quarantine the young. You understand where I'm coming with this? It's like being on the magic roundabout. We're going round and round in circles and with no actual logic involved in it whatsoever. So what they're saying is, we should let everybody out apart from really sick people, but if you've got a sick person in your house, we're not letting you out. They're just going to keep locking us up, locking us not, locking us up, locking us up, not locking us up, locking us up. You see where this is going? The study, which used modelling to predict the virus's spread after lockdown, did not say how much longer elderly people would need to stay cooped up at home. The researchers concluded that the best course of action would be the two-tier approach, which would give young, healthy adults and children greater freedoms while ensuring that the most vulnerable are protected. Certain measures would stay in place, such as the use of the NHSX contact tracing app, social isolation upon expressing symptoms of lurgy, quarantine of entire households, and social distancing. They're saying that we need to get rid of these draconian rules, and then they're talking about even more draconian rules. However, it would allow society's fittest to reclaim some of their lost freedoms at the expense of the elderly. Well, I'm sorry, we should not be giving up certain groups of people's freedoms just to save others. This is not how this country was founded. It's not how this country should be run. It's disgraceful. The most vulnerable, the elderly, and those with underlying medical conditions would still need to avoid anyone potentially infected with the virus. And here comes the tracking app. Here comes the wristbands. Because how would they know without it? You understand where I'm coming from with this? How would anyone know who's got it and who hasn't? I'll tell you how. Wristbands to say that you're the healthy one. Why? Because you've taken the vaccine and you've got the band and you've got the app, so they can track you, they can trace you, they can keep an eye on you even when you're in your home. 1984, anyone? Dr. Bram Bunnick, a researcher at the University of Edinburgh's Usher Institute, said easing the measures taken during the lockdown is important, as they currently have a tremendous effect on our society. Yeah, of course they do. The economy's crashing, our businesses are going under, jobs are being lost left, right and centre. We're going to start running out of taxes because people aren't working. As soon as the taxes run out, we're going to run out of benefits because people aren't working. And if we run out of benefits, people start starving. And if people start starving, you don't want to know what comes next. Done in a way that's both safe for the people that are most vulnerable as well as for the health and safety of the NHS staff. How come NHS staff's health and safety is more important than the population's? Is there a reason for that all of a sudden? Why are the NHS staff more important than everybody else? Just a thought. Segmentation, or should we call it segregation, and shielding is a possible way of achieving this. Measures could be eased for a large proportion of the population. However, the vulnerable population likely still needs to be protected for a prolonged period. Now, they were saying October for our lockdown for the healthy. What's prolonged for the elderly? Is that for the next 2, 5, 10, the rest of their lives? The team said the risk of non-vulnerable people released from lockdown could be managed via effective clinical care and public health measures, as well as ensuring universal high standards of hygiene and hand washing. Good luck with that. Other leading scientists have claimed Britain's lurgy outbreak peaked and started to decline before the official lockdown began, arguing that Number 10's drastic policy to shut down the UK down was wrong. Now, what are my opinions on this? I think it's absolutely vindication for us, is it not? We've been saying this for ages, that the lockdown doesn't seem to have worked for anyone. This seems to have proved that fact for me. I don't know if it does for you, but let me know in the comments if it does. Do you think we need to lift the lockdown immediately, just lift it all together and get back to work? Do you think we should reduce it slowly like they're trying to make out? Do you think we should listen to the WHO in any way, shape or form whatsoever? Because I don't. Do you think we'll ever get a vaccine? And if we do get a vaccine, do you think it will be an every year thing? Do you think the pharma companies are going to make a fortune out of this vaccine? You think about it, billions of people vaccinated every single year. It must be trillions and trillions it'd make from that. Makes me start to wonder if this was all fabricated. But anyway, if you're new to the channel, don't forget to hit the like, comment, subscribe, hit the bell icon and you'll be notified whenever I go live with a new video. Share it out to your social media, everyone, and I'll see you on the next one. Stay safe, everyone.